Hi, this video is the demonstration of the strip linear scar. Again, here's the scar. It's going from one ear and all the way to the other ear. Okay. Again, the results vary from one individual to another, and some of them are bigger and some of them are smaller, and the scar can stretch. I will try my best to give you the least amount of scar, but sometimes depending on the individual genetic, they genetically produce bigger scar and make the surgeon look worse than they are. And some patients genetically produce very fine scar and make the patient look better than who they are. Again, the scar vary from one individual to another, and I try to give as much example as I can. Again, some of them can stretch bigger and some of them can be smaller. But this is the demonstration of the strip linear scar, where the FUE scar is hard to see because I give you tiny dots of scar scattered throughout the back like a mosaic pattern, and you can shave your head without much detectability. The strip method, there's always pro and con for both FUE and FUT. The downside of the FUT or the strip method is the linear scar. More invasive, more painful, more bleeding. There's numbness along the linear scar. But the benefit of the FUT or the strip method is cheaper than the FUE. You can move large number of grafts per day, like 4,000 or 5,000 grafts per day. So it reach your goal faster. So it's more effective for advanced hair loss pattern because it's more efficient in harvesting the hair graft. So, and then the growth rate, both FUE and FUT have excellent growth rate, and the result a lot depending on the surgical skill of the surgeon, to tell you the truth. But however, if you compare the FUT to my FUE, the FUT is 5 to 10% better density. On the other hand, the FUE leave tiny dots of scar and allow you to wear your hair shorter. It's less invasive because we don't cut you open, and that means we harvest one at a time. That means it's less painful, less bleeding, less side effect, and there's no suture to remove. But the downside of FUE are the cost. It's more expensive. The number of grafts we can do is less. We can do 2,500 to 3,000 grafts per day for the FUE, by the FUE, I mean. But as by the strip method, FUT, you can go 4,000 or 5,000 grafts per day. The growth rate, I can produce good, excellent density with FUE and FUT. But if you compare my FUE to my FUT, the FUE is around 5 to 10% less density. Thank you.